Of respiration. Lung volumes and lung capacities are defined as the volume of air present in the lungs at different stages of the pulmonary cycle. They are measured to perform prognosis in patients suffering from obstructive and restrictive pulmonary conditions. Obstructive lung diseases are the respiratory disorders where the patients have difficulty to exhale all the air in the lungs. Patients suffering from restrictive lung diseases struggle to fully expand their lungs with air. In both the categories, the patients suffer from shortness of breath with exertion. There are two major classifications of lung volume and capacities: static and dynamic. Both subclasses are measured at different phases of respiration. Significance of lung volumes and capacities. The static lung volumes are measured to evaluate the obstructive and restrictive pulmonary disorders. The dynamic lung volumes are essential to diagnose obstructive lung diseases. Static lung volume and capacities. It is calculated as normal rhythmic respiration. Time is not taken into consideration. It is expressed in milliliters or liters. The static lung volume is further classified into 4 standard volumes and 4 standard capacities. Lung volumes. Tidal volume. It is the volume of air inhaled or exhaled out of the lungs during normal, quiet respiration. Logically, during normal or quiet breathing, the volume of air inspired is equal to the volume of air expired. In a normal adult male, it's about 500 milliliters, and in normal adult female, it is about 400 milliliters. Tidal volume decreases if there is any respiratory muscle damage or weakness, whereas there is increase in tidal volume if performing muscular exercises. Inspiratory reserve volume. It is the maximum volume of air that can be inhaled above the tidal inspiration. In a normal adult male, it is about 3000 milliliters, whereas in normal adult female, it is about 1900 milliliters. Expiratory reserve volume. It is the maximum volume of air that can be exhaled after the tidal expiration. In a normal adult male, it is about 1100 milliliters, and in female, about 800 milliliters. Residual volume. It is the volume of air which remains in lungs even after maximal expiration. In a normal adult male, it is about 1200 milliliters and 1100 milliliters in normal adult female. Factors affecting lung volumes. High lung volumes are found in people who are fit or athletic, taller, living in high altitudes. Low lung volumes are found in people who are obese, short-heighted, living at lower altitudes. Lung capacities. Inspiratory capacity. Inspiratory capacity is the sum of tidal inspiration and forced inspiration. In a normal adult male, the inspiratory capacity is about 3500 milliliters, whereas in normal adult females, it is about 2300 milliliters. Functional residual capacity, FRC. It is the sum of expiratory reserve volume and residual volume of the lungs. In a normal adult male, it is about 2300 milliliters and 1900 milliliters in normal adult female. Significance of FRC. Due to the presence of some amount of air in the lungs all the time, the exchange of gases take place continuously, keeping the concentration of oxygen and carbon dioxide in the blood constant. FRC allows the holding of breath. FRC helps in the dilution of toxic inhaled gases as a reserved air volume is always present inside lungs. FRC avoids total collapsing of the lungs and hence reduces the load on respiratory mechanism and left ventricles of the heart. Factors affecting FRC: loss of lung elasticity, old age, emphysema, bronchial asthma, increases FRC. Vital capacity, VC, it is the sum of inspiratory reserve volume, that is, the maximum volume of air that can be inhaled above tidal inspiration, tidal volume, and expiratory reserve volume, that is, the maximum volume of air that can be exhaled after the tidal expiration. It is computed as tidal volume plus inspiratory reserve volume plus expiratory reserve volume. In normal adult male, it is about 4600 milliliters, and in normal adult female, it is about 3100 milliliters. Factors affecting vital capacity. Vital capacity is dependent on physiological features of the person and pathological conditions. Physiological. VC is more in males than females due to large size of thoracic cavity. VC reduces in old age due to decrease in lung elasticity. More the strength of respiratory muscles, more is the VC. VC is more in standing position than in sitting or lying position. It is because during sitting or lying position, the diaphragm is pushed upwards and decreases the capacity of thoracic cavity, whereas in standing position, the diaphragm is moved downwards, increasing the size of the thoracic cavity. In pregnancy, VC is reduced as the diaphragm is pushed upwards, thereby reducing the capacity of the thoracic cavity. Pathological. In ascites, VC is reduced as the diaphragm is pushed upwards. VC is reduced in pulmonary disorders like pulmonary fibrosis, pulmonary edema, and others. Total lung capacity. It is the sum of vital capacity and residual volume of lungs. In normal adult male, it is about 5800 milliliters and 4200 milliliters in normal adult female. Dynamic lung volumes and capacities. Dynamic lung volumes are dependent on rate of airflow. Therefore, time is considered as a factor, and the volumes and capacities are expressed in milliliter per minute or liters per minute. The dynamic lung volumes are mostly derived from vital capacity. Forced vital capacity, FVC, it is the maximum volume of air which can be forcefully expelled out after a forceful maximum inspiration. It is also known as timed vital capacity. The FVC is a rapid, forcible, and complete exhalation of air after a maximum inspiration. FVC has three major components. FEV1. It is forced expiratory volume of air which is exhaled in first second of the exhalation. In healthy adults, it's about 80% of the total FVC. FEV2. It is the forced expiratory volume